happy forever. How old are you? Are you young enough? Are you confident of your age? Are you having a gray hair? Do you think that your teeth has to go by your age? No, it doesn't need to. You can preserve your tooth until you die. Am I talking wrong things? Is dental caries or periodontal diseases an old age disease? No. The dental structure, the tooth which you have, has to exist until you are hungry. Whenever you lost your hunger, you can lose your tooth. So you need to have good teeth until you eat. So teeth are for eating. Is it only for eating? No. It is also for smiling. It is also for speaking. If you want to talk legibly, if you want to interact much better, you need to have a good set of teeth. The teeth which are whiter, which doesn't have much of gaps, which doesn't show it out when you are pursing your lips, and the teeth which are in good shape so that you can chew on fruits and vegetables and even meat. Who told you that you have to lose your tooth while you are getting older? You don't need to. You go to a dentist and get the treatments done in the right time. You will save on your tooth and on your bills. Let us check out what is the problem when you become older. You might get diabetes. When you have diabetes, your bone healing is much lower. So what you have to do is the irritants should be removed as early as possible. If you get a small gap and if the food is getting lodged, don't use the toothpick. Go to the dentist, close the gaps. How can you close the gap? He can either fill the gaps or use a crown to stop the food getting in between the crowns, so that the tooth will not allow food to go in. And if the food doesn't go in, your bone will stay there. So if the food goes on, then the bone has to retract back because you are having diabetes. So if you have diabetes, even a small things has to be corrected. If you don't have diabetes, your bone might get healed. And even if it doesn't get healed, you can even put bone back using bone grafting. You don't still have to lose the tooth. Even if the tooth has become lightly loose, we can correct it with periodontal flap surgery and the bone grafting. So even if a tooth becomes loose, you can correct it. Don't wait for the other neighboring teeth also to lose, or don't take it out as early as possible. Please don't do that. Save the tooth so that the other teeth will remain strong. Because if you lose one tooth, the other teeth has to do the job of that tooth. So there will be overload of the other teeth. So if there is overload, definitely it is going to work much lesser. So replace the tooth if at all you have taken it out. Place the tooth there itself if it is possible to correct it. Root canal treatment can be used for correcting pain of the tooth. The sensitivity of the tooth also can be corrected with root canal treatment. Mobility of tooth can be treated with periodontal flap surgery and periodontal treatment. Bone grafting can be used to correct even your gum problems. So get everything done so that your tooth remains until you are remaining in this earth. So please do keep in mind that tooth has not to be extracted, but it has to be kept until you live. If at all you lose one, replace it. Thank you very much.